Hello everyone, and welcome back to another Medicise video. So the next topic in our general surgery series is on appendicitis and mesenteric adenitis. So mesenteric adenitis is a very important differential of appendicitis, and this is because they present very, very similarly. However, mesenteric adenitis is not an emergency, whereas appendicitis can be an emergency. So it's important to know these differentials in order to escalate appropriately. So let's start off with the anatomy of the appendix. The appendix is 5 to 10 centimeters long and it's found attached to the cecum. So the cecum is the first part of the large intestines, and the appendix is almost like a little tail that branches off the cecum. Now, the two most common positions of the appendix is firstly retrocecal and secondly pelvic. Now, these are just important to know in terms of MCQ questions. And the role of the appendix is for growth of good bacteria, which is important in digestion and immunity. So what is appendicitis? So again, anything that ends in itis means inflammation. So appendicitis means inflammation of the appendix. And this is caused by obstruction in the lumen of the appendix. There are many causes of obstruction. However, the most common cause is from fecaliths, which are hard lumps of stool that form and block the appendix. So this blockage then causes stasis and encourages growth of bacteria, which then leads to infection and inflammation, which is why the appendix becomes swollen. Now, the common risk factors for appendicitis is that they mostly occur in men, and there are two age peaks in which they are most common in. The first being early teens and the second is in the 20s. And lastly, a family history of appendicitis also increases the risk. Now, how does appendicitis present? Well, classically, it presents with colicky, periumbilical pain, which then migrates to the right iliac fossa and becomes constant. Now, when patients describe this pain, they'll say that it happened within the last 2 to 3 days. So it's a very acute onset. If patients describe their pain lasting about a couple of weeks, 3 to 4 weeks, it's less likely to be appendicitis because appendicitis has a very acute onset and it can be very difficult to manage at home. In addition to the pain, patients can also experience nausea, reduced appetite, constipation, and a fever. Now, some signs that you may notice when examining patients is right iliac fossa pain, because that's where the appendix is located, and also guarding in the right iliac fossa. So guarding is when you palpate the patient's abdomen and they flinch every time that you press on the abdomen. There are also 3 specific signs relating to appendicitis called Rovsing, psoas, and obturator signs. So Rovsing sign is a very common sign for appendicitis. It's when you palpate in the left iliac fossa and this causes pain in the right iliac fossa. So the second sign is the psoas sign, and this is when you place your hand on their right knee and you ask the patient to lift their leg up against resistance. So as they lift their leg up, you push down on their knee. And if there's pain present, that means that it's psoas positive, which is consistent with appendicitis. The last sign is called the obturator sign, and this is when you ask the patient to lie on their left side so that the right side is up. You bend their right leg at the knee and you internally rotate their knee. If there's any pain or discomfort, this is a positive obturator sign, which again is consistent with appendicitis. So how do we diagnose appendicitis? Well, it's usually based on history and examination, but it can be confirmed with imaging as well. So let's split up the investigation into 3 categories: bedside, bloods, and imaging. So bedside investigation include doing observations such as heart rate, temperature, blood pressure. So in appendicitis, you might find that the patient's heart rate has increased, so they're tachycardic because of the pain. And you also might notice that the temperature has increased because of the infection of the appendix. Second is a urine dip to rule out any urinary tract infection. And lastly, a very important test is to do a pregnancy test on any female of childbearing age, and that's to rule out any risk of ectopic pregnancies or any gynae-related conditions. The next step is to do bloods. So it's important to do a CRP and a full blood count to check if there's any raised inflammatory markers. So because this is inflammation of the appendix, we're looking for raised inflammatory markers. Doing some U's and E's to check the electrolyte and kidney functions. With any abdominal pain or any abdominal pathology, it's very important to do LFTs and amylase. So amylase is very specific for pancreatitis. So it's important to rule out pancreatitis in any abdominal condition. And if we're thinking that this patient might need to go to theatres, it's important to do a group and save and a clotting. So there are 2 types of imaging which can be performed. The first is ultrasound scan, which is often used in children, pregnancy, and in females, which we cannot exclude gynae pathology. And the second, which is a more accurate form of imaging, is to do a CT scan. And these are often used in older patients, or if the diagnosis is uncertain, or if we're looking to rule out complications, for example, a perforation or an abscess. So how do we manage appendicitis? Well, there's 2 ways to manage appendicitis. The first is conservative treatment and the second is surgical. So conservative treatment include being treated with antibiotics, and this is used to treat uncomplicated acute appendicitis where the patient is stable. However, they may be at risk of redeveloping appendicitis in the future if we do not remove their appendix. So the second form of treatment is to do surgery, and this is the more definitive approach. And this is to perform an appendicectomy, which is a procedure to remove the entire appendix. So this is done in severe appendicitis or in patients with complications secondary to appendicitis. Okay, now let's move on to mesenteric adenitis. So this is an important differential in patients presenting with symptoms similar to the ones that we just described in appendicitis. So mesenteric adenitis means inflammation of the lymph nodes in the abdomen. Lymph nodes are small glands which can be found throughout the body. However, these specific ones are found in the abdomen. So if we split up the word mesenteric adenitis, mesenteric means mesenteries, which is part of the abdomen where the glands are located, and adenitis means inflammation of the lymph nodes. So the common cause of mesenteric adenitis is from a viral infection. So risk factors, these are very common in children, particularly under the age of 16. And if we have a look at the symptoms, they also cause right iliac fossa pain, fever, and nausea and vomiting. So you can see why it's very similar to appendicitis. However, there's one symptom which can be used to differentiate between mesenteric adenitis and appendicitis. And that's if the patient has had a flu in the last few days to weeks. So if the patient reports being unwell, so having a cough, a cold, a few weeks before their abdominal pain starts, it's most likely mesenteric adenitis. Again, with the blood test, if the inflammatory markers aren't as raised as they would be in appendicitis, and the patient reports having a flu in the last few weeks, together you can put an initial diagnosis down as mesenteric adenitis. So investigating mesenteric adenitis is all the same investigations as you would do for appendicitis. So doing observations, urine dipstick, doing a blood test, and imaging, which we would use ultrasound scans. So the management of mesenteric adenitis is very simple. The symptoms usually improve within a few days and will almost always clear up within about 2 weeks or so. So there's no real treatment for mesenteric adenitis. It's more for symptomatic relief. So if they're in pain, giving them analgesia. If they're feeling nauseous or vomiting, giving them antiemetics. Okay, let's see how much you've learned. So there are 5 questions, and for each question, we'll give you 15 seconds to answer. If you feel like you need more time, feel free to pause the video at any point. Let's get straight to it. So the first question, what are the 5 common symptoms of appendicitis? Okay, let's have a look at the answer. So the first one is colicky abdominal pain, which then migrates to become constant right iliac fossa pain. The second is nausea or vomiting. Third is fever. Fourth is reduced appetite. And 5 is constipation. All right, let's move to the next question. What are the 3 specific signs of appendicitis? So what are the 3 specific signs when examining a patient that you will find only in appendicitis and not in any other condition? Okay, let's have a look at the answer. So the first one is Robsing sign. So that's when you press on the left iliac fossa and you get pain in the right iliac fossa. Obturator sign, that's when you get the patient to lie on their left side so that their right leg is up. You then bend their leg at the knee and you internally rotate their leg. And if they have pain, that's obturator positive, which is consistent with appendicitis. And then finally, psoas sign, that's when you get the patient to lift their right leg up against resistance. And if they have pain, that's psoas positive, which is consistent with appendicitis. What imaging is used in children and pregnancy for suspected appendicitis? All right, let's have a look. Ultrasound scan. So ultrasound scan is the safest mode of imaging for children and pregnancy. And that's because CT scans include contrast, which is not safe for the kidneys. Question 4. What is the management of appendicitis? So there are two forms of management of appendicitis. One is conservative, which is treatment with antibiotics, fluids, analgesia. The second is surgical management, and that's having an appendicectomy. Now, laparoscopic appendicectomy just means keyhole surgery, compared to open appendicectomy, which is where you have an incision down the midline of your abdomen, and they open up your abdomen entirely to remove the appendix. Now, last question, how can you differentiate between mesenteric adenitis and appendicitis based on symptoms? Okay, so to differentiate between mesenteric adenitis and appendicitis based on symptoms, patients with mesenteric adenitis will have flu-like symptoms before the onset of abdominal pain. So they might have a cough, cold, sneeze before the abdominal pain starts. All right, good job, everyone. So this is just a summary table of appendicitis and mesenteric adenitis for revision purposes. And I hope you enjoyed that video. So that's another video from Medicise. If you do like the video, please like, share and subscribe. And comment below for any topics that you'd like us to cover next. Hope you have a great day and see you in the next video.